I like looking good. You know, I'm over 40. I like to look good for me. And certainly for Scott. I mean, we had lived here about 6 months when Scott said, hey, you know, have you thought about, you know, maybe getting breast implants? I said, you gotta be kidding.
Okay, so go ahead and stand.
Okay. I went from a 32A to a 32D. And most women I spoke to wish they had gone bigger.
Okay, well, that was a scene from the hit reality TV show, The Real Housewives of Orange County. Little nip here, little tuck there. The Society of Plastic Surgeons says more and more mothers are going under the knife to get their pre-pregnancy figures back. They are getting the triple combo, that's what they call it anyway, stomach lift, breast augmentation, and breast lift. So what is going on? Well, let's ask our guest, plastic surgeon, Dr. Jennifer Walden. Dr. Walden, thanks so much for being with us.
Thank you.
All right, so now it said, according to the study, there's been an 11% increase in this triple combo mommy makeover since just 2005. What explains the surge in this procedure?
Well, I think women are giving birth later in their lives. They're returning to their career sooner, and they also have busier schedules than ever before. And so there's an increased societal acceptance for them to undergo surgery and get a lift or a tuck back to that pre-pregnancy state.
Is it possible, you know, once women have a baby, obviously they have excess skin on their stomachs, is it possible to get that flat stomach again without having a stomach, a tuck, a tummy tuck?
Actually, once the muscles of the abdomen stretch with pregnancy, it's hard to get rid of that extra skin that's stretched, and that's where a tummy tuck comes in to tighten the muscle layer and also to get rid of the droopy skin. Also, the same thing happens with breastfeeding. The breasts involute after being stretched with breast milk, and that's when an augmentation and mastopexy or breast lift comes in.
Now, women they're supposed to wait until they're done with all their children before they have this.
Absolutely. For augmentation and lift, it's a good idea, I think, to wait until after you've completed breastfeeding with your children and then undergo that procedure, and then a tummy tuck as well, because if you got pregnant again afterwards, it would just basically stretch the repair, and you'd have to probably get some type of little revision procedure afterwards.
And how much does this whole combo cost?
Well, actually, if you break it down, each procedure probably, depending on the national averages, is around $5,000 to $10,000. So if you got a triple combo, you're running about $30,000 to $50,000.
Whoa! And insurance doesn't pay for any of that?
No, no.
Now, there's some controversy about this. Some people, like there was an article in the San Francisco Chronicle where somebody was saying, look, this feeds into the unrealistic expectations that society places on mothers to have these young, nubile bodies, notwithstanding the fact that they're moms and they've given birth to children.
Well, I don't think that's necessarily true. I think that women undergo special changes after they've had kids, and men don't undergo those changes, and it's absolutely their right to go ahead and get surgery to kind of restore a normal shape and appearance that they once had.
Wow, so interesting and very costly, as it turns out. Dr. Walden, thanks so much for being with us.
Thank you so much, Megan.
We appreciate it. Bill?
After weeks of waiting.